Hi fam, this is Vanice. Welcome to my channel. So today I am going to be talking about my experience, my personal experience concerning mammograms. I'm going to discuss some things to consider, some things to prepare for if you're going for your first mammogram, or some things you probably forgot about if you're going for your second or your third. Either way, if this is information that you are interested in, stay tuned. So here's the deal. I am not a medical professional. I'm not a health professional, whatever you want to call it. If I need to insert a good old disclaimer, fine. Because what you're not going to do is come for me like I'm a hospital admin, like I got RM, MD, all them things behind my name. And don't. So I have 8 things for you to consider or to keep in mind when you go, either when you schedule or when you go for your mammogram. Number 1, of course, this is the time to truly take into consideration, do you have high pain tolerance or do you have low pain tolerance? If you generally have low pain tolerance, then make sure that you schedule your mammogram during the time of the month where your breasts are not so tender. Number 2, don't wear deodorants, or make sure that you have, an extra thing of deodorant with you, because if you are wearing deodorant, I'm going to give you some wipes so you can wipe it off, because the concern is that if your deodorant has metallic particles, it may skew the results. And we ain't got time for any confusion concerning mammogram results. So if you're going to your appointment from home and you're going back home, then you can put on deodorant once you get back home. But of course, if you're out and about, 9 times out of 10, you're going to have deodorant on anyway. So they'll give you some wipes to wipe your underarms. And I'm saying deodorant. Make sure that you're not, here's the deal. This might be something extra. It should be the norm, whenever you go to doctor's appointments. You shouldn't be wearing perfumes or scented lotions. You have to, respect other patients. There are a lot of patients with serious allergies, okay? And a lot of times doctors, within the office, they'll have those flyers up, to please not wear scented lotions, perfumes, etc. So, of course, you shouldn't be wearing anything like that on your armpits, because we ain't got time for confusing mammogram results, okay? Number 3, wear a top that's easy to take off and put back on. And a top and undergarments that's easy to take off and put back on. I would not recommend, like jumpsuits, dresses, because for a mammogram, of course, they'll give you, like one of those, I guess you can call it medical jackets. If there's an actual term for it, I'll put it down there. But you're just wearing one of those open jackets. Number 4, if you have any type of injuries or any type of skin tags in that area, let the professional know. There should be nothing to assume. I know my first time, they gave me like little, they reminded me like little bandages. It was holding down the skin tag so it wouldn't get squished. Because that takes me to number 5. Your breast, each one, because they have to do one breast at a time, it will be pressed between the machine and a platform. So just know that if you didn't know. I don't want to assume, I'm sure there's people out there what duh, Vannies. Some people may not know. Some people may not know why women are always complaining that it hurts, okay? If it, like I said, it doesn't hurt for me. So, and here's the deal. On that note, because your breasts are going to be squished, if it hurts, if something hurts, let them know. I know both times those professionals, to me, were very professional. I believe went above and beyond to explain everything that they were going to do. They repeatedly ask, are you okay? Does this hurt? And I'll be like, no, I'm good. That takes me to number 6. Be prepared. Let me stop. as I was writing this. Every time I said be prepared, I thought about Boy Scouts and Lion King. So be prepared for, I'm going to call it professional touches, okay? Because they need to make sure that you're positioned correctly. You know what it reminds me of? And I'm saying this in an innocent way. Do not twist this mug around. You know how when you're taking pictures, school pictures, for my 80s and 90s kids, Olin Mills, you know how they would always tell you, turn, tilt your head, do what? It's going to be a lot of turning. So that's what it reminded me of. I'm like, this is like school picture day, you know, all the turning and stuff that you're going to be doing. So just be prepared for all that. And they are trying to position you in a way that, of course, your alignment is going to be perfect for, you know, for the few seconds that they do their imaging, and then moving on to the next position. Okay. Number 7. I told you your breasts are going to be squished between, you know, the machine and the platform that your breast is on. Anytime you have to go to the next position, manually, like literally lift your breast up off that mug. Do not sit there and like move back like your breast is going. I'm just letting you know. Please manually lift up your breast. And some of you, I'm not going to go. Just manually do that. Because it's not going to be comfortable if you sit there and move back and it's kind of like stuck there because of friction. Just lift it up. And of course, the professional will be there to help you for your next position. All right. Number 8. This might be different considering your respiratory health. Be prepared to hold your breath for a few seconds, okay? The reason why they ask you to hold your breath is because they need the images as still as possible, okay? And so, of course, when you breathe, you know, we have a lot going on, you know, within our chest. We have our lungs, we have our ribs. So, of course, with the inhale and exhale, that's movement, and your breasts are right there. So that's why they ask you to hold your breath. So there's no movement within the images, okay? I've not had, this past appointment, there were no issues with that, and I don't recall that being an issue my first time. It was just in my mind during this appointment, I was thinking everything that I needed to say for this video. For that first image, when she said hold your breath, I was like, oh, I forgot about this. Hopefully these 8 tips helped. If I think of anything else, I may come with an addendum video. Yeah, comment below if you can think of anything else that needs to be said. Comment below if you have any questions. I tried my best to think of everything. Yeah, especially if this is new to somebody, it's not fair to assume what people should know. Well, duh this and duh that, that's you. That's not everybody. So hopefully this helps. Yes, yes, yes. And at the end of the day, this is for our health. Everyone in some way, shape, or form has been affected. Whether you've been personally affected or you have people connected to you who have been personally affected by breast cancer, just go and get the mammogram. This is something else that just crossed my noggin. Depending on the place that you go to, like when I walked in, what I recall in this particular room had like, you know, like different stickers on the wall, like little spirals. It looked like party decorations, because you have to realize everybody's, I guess you could say everybody's medical experience, appointment experiences are different. I'm fine going to doctor's appointments. Some people legit have appointment anxiety, and sometimes it may show up as pain, it may show up as high blood pressure. It just depends. It may just show up in your attitude, you know. But I like the fact when I've gone, it seems like they try to, because of course it's dark in the room, but they try to make it as pleasant as possible, because you never know what people are going through when they walk in. especially if they have a family history of breast cancer. If they are dealing with breast cancer, for goodness sakes, they can be, in their minds, they could be experiencing doom and gloom walking into that space. So that's why I appreciate the professionals that I've dealt with. Were professional, were very caring and attentive, repeatedly asked me, does anything hurt? Are you okay? I appreciated that. So, and I hope that's across the board, and I'm sure you'll comment down below if that's not the case or if that is the case. So, thank you so much for listening, for watching. Please remember to subscribe, like this video, and share. Thank you so much. Have a good one. Until next time.